Yes po, Doc.
Na tayo. Okay, so this would be your lecture on the blood supply or the vasculature of the brain as well as the spinal cord. Okay, so you finish with your lecture on the scalp, meninges, no? So we are going to go inward, no, towards the brain. But we will not take up the brain itself, but we will take up the blood supply. Okay. Now, at this point, I'm presuming that in Neuroana, you have finished already with your lecture on the functional areas, no, of the cerebral cortex, yung mga Broadman area. Okay? You already know what function is supposed to be attributed to that particular Broadman area. Or that is because it is important when we are talking now of blood supply to the brain and the spinal cord. Okay. So a particular area of the brain supplied by this artery will of course be important, no? Especially in the function of that particular Brodmann area. Okay, so let's go first with the vasculature. So we try to understand what the carotid system and the vertebral system of vessels are, and how the branches of these two systems provide blood supply to the brain as well as the spinal cord. Okay. Needless to say, we will study the branches, of course, of the internal carotid artery as well as the intracranial branches of your vertebral artery. We will go also into the venous drainage of the CNS, not only the cerebrum but also the spinal cord, and some clinical aspects related to the blood supply of the brain and the spinal cord. Okay, so let's start first with the arteries that give blood supply to the brain. That will be your internal carotid artery and your vertebral artery. Now, the internal carotid artery, okay, uh, is a branch of the common carotid artery. On the right, okay, the common carotid artery emerges, okay, from the brachiocephalic artery, this one here. Because on the right, the brachiocephalic artery is the origin of the right subclavian and the right common carotid. Unlike the left, no, where they are direct branches of the arch of the aorta. Okay. So also from the subclavian artery, okay, branch of the brachiocephalic, will come the vertebral artery. Okay. So the vertebral artery supplies about 1/3, okay, of the blood to the cerebral hemisphere, while your internal carotid artery supplies a greater 2/3, okay, of the blood supply to the cerebral hemisphere. Okay. If you will follow the vertebral artery from its point of origin, the subclavian artery, you will notice that its course is almost vertical, no? Upward along the position of your cervical vertebrae. Okay. Now it passes through this canal, no? The canal that through the where the vertebral artery is passing through is actually formed by the alignment of the transverse foramen of each cervical vertebra. Okay, you recall your lecture on the cervical vertebrae that they possess, one of each of them possesses your transverse foramen. Now, if you put one cervical vertebra on top of the other, and you align the transverse foramen, you will now form a canal or a tunnel through which the vertebral artery will pass through, almost vertical, until it emerges through the foramen magnum and into the cranial bone. Now, of course, the vertebral artery will have branches, no, before it will enter the cranial bone, but our interest will be mainly the branches that will be found when it is already inside the cranial bone. Now, in the internal carotid artery, from its bifurcation, no, from the common carotid at about the level of the superior horn of the thyroid cartilage, okay, will also travel almost directly upward. Okay? It will pass through an opening at the base of the skull known as the carotid canal. And from the carotid canal, it will travel an somewhat oblique course, and it will emerge via the foramen ocere inside the cranial bone. Okay, so it will not emerge in the opening in the carotid canal kasi wala namang carotid canal opening on the inferior surface of the cranial bone. No? Wala ang carotid canal opening if you look at the cranial wall from the inside. Okay? So instead, the internal carotid artery will emerge via the foramen cassette. And from there, will give up its branches. Now, we'll study first the internal carotid artery. Okay? Now, it is said to be, the internal carotid artery is said to be subdivided. Okay? I'm sorry. Mahina pa yung audio?
Dok, konti po.
Okay, dali lang ha. Kasi I was asking kung okay yung audio ko, hindi. Okay. Okay, how about now? Is it okay?
Dok, okay naman po. Medyo mahina lang po if pwede pong lakasan po ng konti.
Okay, how about now? Is it okay?
Yes po, Dok.
Are you sure?
Yes po.
Okay, so we'll try to proceed. Huh? Okay, as I started, no, the internal carotid artery is subdivided into 4 segments: cervical, petrous, cavernous, and cerebral portion. Now, the cervical segment is basically what we see at the level of your cervical vertebrae. Okay, and from there, okay, it will enter the carotid canal, okay, which is at the base of the skull. Now, our concern mainly would be the cerebral segment of the internal carotid artery, from which will come the branches that will go mainly to the brain. Okay, so in the cerebral portion of the internal carotid artery, you will have the following branches. Okay, the ophthalmic artery, among the branches, among the cerebral branches of the internal carotid artery, will be an artery that will not go to the brain, but instead it will go into the orbital cavity because it will give off the blood supply to the eyeball. Now the other branches, your superior hypophyseal, will go to the pituitary gland, your posterior communicating artery, okay, which attached which will anastomose with the posterior cerebral artery. Your anterior choroidal, which is this artery here that goes backward, okay, to enter the inferior horn of the lateral ventricle and eventually form your choroid plexus. And the terminal branches of your internal carotid artery, which are the middle cerebral and the anterior cerebral artery. Okay. Now, before we go into the branches, or before we go into the cerebral arteries, no, you have 3 cerebral arteries actually. Okay, you have anterior cerebral artery, middle cerebral artery, and your posterior cerebral artery. Okay, of the 3 cerebral arteries, no, The middle and anterior cerebral arteries come from the internal carotid. But your posterior cerebral artery comes from the basilar artery. Okay? The basilar artery in turn is formed by the union of the vertebral artery. Okay? All right. So before we go into the three cerebral arteries, I'd like to inform you, okay, that each of the cerebral arteries will have two groups of arterial branches. Okay. You have what is known as the cortical branches, and you will have also what is known as the central branches. So yung each of these, the cerebral arteries, ng tatlong ito, okay, will have a central branch. It will have a cortical branch. Now, the cortical branches, needless to say, it goes to the cerebral cortex. Okay? So it goes to the cerebral cortex, while the central branches of these cerebral arteries will go into the center of the brain. Okay? To supply the structures that are found in the interior of the brain. Talking about the basal ganglia, the encephalon, etc. Okay? So let's start first with your anterior choroidal artery, which this one that goes backward. Okay? Yeah, the anterior choroidal passes backward and enters the inferior horn of the lateral ventricle and ends in the choroid plexus. Okay, all right. Okay, sorry. To continue, okay, like I said, the anterior choroidal artery goes inside the lateral horn of your ventricle. Okay, and it will become your choroid plexus. Now, the anterior choroidal artery also supplies the lateral geniculate body, the posterior limb of the internal capsule, and three-fifths of the crus cerebri or the cerebral peduncle and the globus pallidus. Okay. Okay. Now, when we talk about the anterior cerebral artery, we are talking about this artery here. Okay. Now, this is a view of the cerebral cortex, okay, from the medial side. Okay, and you will see this artery here. This is the anterior cerebral. Okay. Now, the two anterior cerebral arteries, as you see here, okay, will give up a branch that will allow the two cerebral arteries from both sides to communicate with one another. So this is what you call the anterior communicating artery, which is a branch from the anterior cerebral that will allow the anterior cerebral artery to anastomose, or we say with each other. Okay, all right. Okay, so it is joined by the anterior communicating artery. The cortical branches of the anterior cerebral will supply the medial surface of the cerebral cortex. Ito, we're looking at the medial side, right, of the cerebral cortex. It will supply the medial side of the cerebral cortex as far back as the parieto-occipital sulcus, okay, and even upwards to the superior border over the superolateral surface of the cerebral hemisphere. So it does not only supply the medial surface here, it will go even over the top here. So that about an inch from the median sulcus, okay, you will have a portion of the cerebral cortex that is still under the blood supply of the anterior cerebral artery. Okay, but the rest of the lateral surface of the cerebral cortex is no longer the territory of the anterior cerebral. Okay. Now there are the central branches, like I said, which supplies now the interior of the brain, specifically the caudate nucleus, the anterior part of the lentiform nucleus, and the anterior limb of the internal capsule. Okay. Okay, so on the medial side, you will see that the anterior cerebral artery supplies the medial side of the frontal lobe. Okay, and via the medial or orbitofrontal artery, it also supplies your partly your parietal lobe on the medial side. Okay, okay, and through these branches, okay, of the anterior cerebral artery, it will also supply your corpus callosum. This one, this white structure here, this is a type of commissural type of white matter, okay, connecting the left side of the cerebral cortex to the right. Okay, so 4/5 of the anterior of your corpus callosum derives its blood supply from the anterior cerebral artery. Okay. Now, also from the anterior cerebral artery, since it's already here near its territory, will be the blood supply to the olfactory tract as well as the olfactory bulb. Okay. Now, coming also from the anterior cerebral artery will be your recurrent artery of Hebner. It is a special branch of the anterior cerebral artery, proximal or before the location of the anterior communicating artery. And it supplies the head of the caudate nucleus and putamen. Now let's go to the other of the two terminal branches of the internal carotid artery, and that would be your middle cerebral artery. The middle cerebral artery, as you see here, courses along this fissure. This is your Sylvian fissure. And at the depth of that would be where you will see the middle cerebral artery, at least the terminal end of the middle cerebral. Okay. And the cortical branches, needless to say, will supply most of the superolateral surface of the cerebral hemisphere and the insula. The insula is the fifth lobe of the brain, which is hidden from view, okay, from either lateral or the medial side of cerebral cortex. If you separate the Sylvian fissure or we open up the Sylvian fissures this way, that's the time you'll be able to see the insula. Okay. All right. The cortical branches supply most of this. Okay, what you see on the lateral side of the cerebral hemisphere is now the territory of the cerebral, of the middle cerebral artery. Okay, so frontal, parietal, okay, and even temporal lobe. Okay, except the inferior surface of the temporal lobe. Okay, will be the territory of the cortical branches of the middle cerebral. Now, what about the central branches of the middle cerebral? It supplies the lentiform and caudate nucleus, the genu, and the posterior limb of the internal capsule. Okay. You finish already with the internal capsule in Neuroana, you know that the internal capsule has an anterior limb, a posterior limb, and a genu. Okay. Kasi it's like a V-shaped no configuration yung internal capsule mo. Okay. Okay. Now, the posterior limb of the internal capsule is supplied via the lenticular striae branches of the middle cerebral artery. Okay? Okay. Now, the lenticular striae branch of the middle cerebral artery is an example of a central branch of a cerebral artery. Okay? Now, the central branches have characteristics that are not similar to the cortical branches. The central branches are described as long, okay, slender, and thin-walled. Okay. So, especially the lenticular branches of the middle cerebral, okay, this is one of the arteries that are commonly involved in intracerebral or intracranial hemorrhage or intracerebral hemorrhage because they are long and slender and they are prone to rupture, especially if they have increased uh, uh, blood pressure, okay, that can cause hypertensive bleed or cerebrovascular accident. Okay. Okay. Okay, so this is basically what I mentioned earlier. That the bulk of the lateral surface of the cerebral hemisphere will be under the middle cerebral, okay, artery, except the superior portion here. Okay. Now, the superior division of the middle cerebral artery via the lateral inferior frontal lobe, okay, where you have your Broca's area here. The Broca's area and the inferior division supplies the Wernicke's area here, okay, which is a portion of your parietal lobe. Okay. Now, the Broca's and Wernicke's area are concerned with language. okay, language, okay, spoken language and comprehension of language. Okay, when you are able to understand the spoken language, okay, then that is the function of the word association. Now, for you to be able to speak, okay, or respond if asked a question, okay, it will be your broadcast learning that is concerned with expression of speech. Okay, all right. So both of these areas are concerned with speech. Okay, and both of them are within the territory of the middle cerebral artery. Okay, the deep branches supply the basal ganglia as well as the internal capsule. So that would be your anterior and your middle cerebral artery for you. Now let's go to the vertebral artery. This one. Okay. From the cranial portion of the vertebral artery, meaning hindi pa sila nag-unite to form the basilar. Okay. Each of the vertebral artery will give off your spinal arteries. It will give off the anterior and the posterior spinal artery. Okay. The branches that form the anterior spinal artery, okay, coming from each side of the vertebral artery, will unite to form a single anterior spinal artery. Okay, but your posterior spinal artery, okay, this one, posterior spinal, will not. They will not unite, okay, as one. Okay, and they will proceed downward as two separate arteries along the posterior side of the spinal cord. Okay. Now, also coming from the vertebral artery will be your posterior inferior cerebellar artery or your PICA, PICA, okay, will come from your vertebral artery. Okay. Now, when the two vertebral arteries will unite and form this artery here, the basilar artery, which is located or which will be lodged in the basilar groove of your pons. Okay. And at about the lower border of the pons, the two vertebral arteries will unite to form the basilar. Now, this time, from the basilar artery will come your ICA, which is the counterpart of your PICA from the vertebral artery. Your ICA, your anterior cerebellar artery, okay, will come from the basilar. Okay. You will have your labyrinthine artery. You will have your pontine branches. And before the basilar artery will terminate as your posterior cerebral, it will give off first the superior cerebellar artery. Itong dalawang to, inferior cerebellar. Itong isang to, superior cerebellar. So before the termination of your basilar artery to posterior cerebral, you will have your superior cerebellar artery. Okay? All right. Now let's go to the cortical branches of the posterior cerebral artery. Okay? It supplies the medial and inferior surface of the temporal lobe, okay, as well as that of your occipital lobe. So this will be the temporal lobe here. Inferior surface will be now under the territory of the posterior cerebral, as well as the occipital lobe here. The entire occipital lobe, right, will be under the territory of the cortical branches. Okay. Now the central branches of the posterior cerebral, okay, you have your posterior median ganglionic branch and the posterolateral ganglionic branch. Okay. The posterior medial ganglionic branch will supply the medial surface of the thalamus since it is the one that forms the wall of the third ventricle. Your posterolateral ganglionic branch, okay, is the one that goes around, okay, it goes around the cerebral peduncle to be able to supply portions of the thalamus. Okay. Okay, so those would be the destination of the central branches of the posterior cerebral artery. Okay, now let's talk about the circuit of Willis. Okay, this is the circuit of Willis here. It is formed by the interconnection of branches coming from the internal carotid artery and from the branches of the basilar artery. Now, actually, if you think about it, no, the circuit of Willis allows blood, okay, that goes to the, to the, brain, okay, via the vertebral artery, and via the internal carotid artery, okay, to be equally distributed, okay, around or all over the brain and the spinal cord. So that you see, one of the purpose of having circular village is to ensure almost an equal distribution of blood flow, okay, to the different parts of the brain via the branches of the internal carotid and the union of the vertebral artery to become the axilla. Okay? Now, the circle of Will is not actually a circle, it's more of a pentagonal shape, no? And it is located, okay, at the base of the brain, okay? Communicating arteries from both anterior cerebral, internal carotid, posterior communicating arteries, and posterior cerebral will form the circle of Willis. Okay? It lies at the base of the brain. Okay? If you're looking for the circle of Willis, you look at the base of the brain. Okay? And it is right around the area of the sella turcica. Okay? Close to the optic chiasm and the tuber cinereum. Okay? Now, these are some of the clinical conditions or pathologic conditions that develop in among blood vessels in the brain. Okay, you can have this. This is what I mentioned earlier: the reticulostriate branch of the middle cerebral. They can develop microaneurysms. Okay, and aneurysms are, okay, one of the areas that can rupture. That can okay, so microaneurysms are prone to rupture, especially if you have increased pressure within the blood vessels in the brain. So when you have hypertension, okay, these are one of the areas that can give way and cause hemorrhage, okay, or bleeding from within the parenchyma of the brain. Okay, okay. Now you also have bleeding in the subarachnoid space. Okay? Subarachnoid space, meaning underneath the arachnoid matter. Okay. Now the subarachnoid space, is a space that contains your CSF. Now the subarachnoid space in the cranial vault communicates with the subarachnoid space in the spinal cord or the vertebral column. Okay, so whatever you have in the subarachnoid space in the cranial vault will also be the same thing that you will have in the subarachnoid space in the spinal cord. So if you have bleeding in the subarachnoid space here in the cranial vault, then you will also have blood in the subarachnoid space of your spinal cord. Okay? This is also another pathology involving blood vessels in the brain, your arteriovenous malformation. Okay? These are abnormally large, okay, caliber blood vessels. Okay? They are, you can consider them as congenital, shall we say, formation of the blood vessel. Okay? And since they are of normal size, okay, they also can be prone to rupture. Okay? So they have bleeding from an AV malformation. I believe this is one of the common cases of intra bleeding in the young age group. Okay? You can also have the intracerebral hemorrhage. Like I said, if you have a rupture of a microaneurysm in your reticulostriate arteries, then you can have blood here within the parenchyma of the brain. Okay? Okay, now let's go to the venous drainage. Okay? Venous drainage of the CNS. Okay? First, we try to describe the veins of the brain. Okay? They are thin-walled, as you would expect in different veins, okay, of the body. But unlike the lower extremity of veins, your veins in the CNS do not contain valves. Okay? So although there is a preferential flow towards one direction, okay, it is not uncommon for a venous blood to backflow in a different direction if there is an obstruction. Okay, kasi you will understand that there are no valves. that can ensure a unilateral or a unidirectional flow, okay, of your venous blood. Okay. Now the veins are seen at the subarachnoid space, okay, of the cranium. Okay. And the venous blood will find its way through the cranial venous sinuses or dural sinuses, shall we say, to ultimately drain into the internal jugular vein. Okay. Now, the veins of the brain, okay, have two sets. You have an external and an internal cerebral set of veins. Okay. Here. Now you have lifted the dura mater, and what you see on the surface of the cerebral cortex are your external set of veins. Okay. Notice that the external set of veins are readily seen on the surface of the brain. Okay. They drain blood from the cortex and subcortical medullary substance to empty into nearby sinuses, okay, like this one. Superior sagittal sinus is the point of drainage of your superficial cerebral veins. Okay? Yeah. Notice that all of them will eventually find their way into the superior sagittal sinus. Now, the bridging veins that connect that connects your superficial cerebral veins with your superior sagittal, this one, the bridging veins here. This point of entry is fixed, meaning it does not move. Okay? Unlike the brain that floats in CSF, this point of bridging, shall we say, as the cerebral veins empty to the superior sagittal sinus, is a fixed point. Okay? Meaning, although the brain floats in CSF, this part does not. Okay? And that's an important characteristic, especially in patients who sustain subdural hemorrhages related to vehicular accidents. Okay. Alright. So going back to the external set of veins, you have the superior cerebral, inferior cerebral, and the middle cerebral veins. So yung superficial middle cerebral. Ito yung mga superior cerebral veins. Okay. In your inferior. This is how it would look like in the diagram. Okay. This is how the superficial cerebral veins will be described. They lie within the subarachnoid space. The superior cerebral vein will drain the lateral surface of the cerebral hemisphere and empty to the superior sagittal sinus. The superficial middle cerebral in turn, running along the lateral fissure of the brain, empties to the cavernous sinus. Now, the superior anastomotic vein of Trolar drains to the superior sagittal sinus. This vein, ito malaking vein na to. The superior anastomotic vein of Trolar drains to the superior sagittal sinus. Like I said, these veins do not have valves. Okay? So the superior, it's vein of Trolar, so it carries blood preferentially to the superior sagittal sinus. If you have a problem with the venous flow here, then it can backflow back into mid superficial middle cerebral and outward into your inferior anastomotic vein to drain to the transverse sinus. Okay? This is the inferior anastomotic vein. Alright, so those are your superficial veins of the cerebral cortex. Now let's go to the internal set of veins. Okay? On the internal set of veins, they drain the interior of the cerebral hemisphere, specifically the basal ganglia, internal capsule, the encephalon, the choroid plexus, okay? And from these internal structures, the venous blood will eventually find their way to the internal cerebral vein. Internal cerebral vein on both sides. Okay? And then they will drain, both of them will drain to your great vein of Galen. And the great vein of Galen will now find its way to the straight sinus. The great vein of Galen. Now, the great vein of Galen is located here at the splenium portion of your corpus callosum. Okay. Now, your internal cerebral vein will empty to the great vein of Galen. The great vein of Galen will unite with your inferior sagittal sinus, okay, And both of them will empty the straight into the straight sinus and into the confluence of sinuses. Okay, so that would be for the interior. No? So, okay, the interior set of veins drain the central portion of the structure within, no, and the central portion of the brain. So the thalamus tree veins and the choroidal veins are the ones that drain the interior of the brain. They drain the basal ganglia, the thalamus, the internal capsule, okay, and the choroid plexus and hippocampus. These veins, ayan, itong mga veins na to, may merge to form the internal cerebral veins on each side. So meron pang internal cerebral vein on each side, left and right, okay? The two internal cerebral veins will unite in the midline to form the great vein of Galen, okay? Okay, which lies at the ano to, ayan, the splenium of the corpus callosum. Yung corpus callosum mo, the splenium part, that's where you find the great vein of Galen, okay? And from there, the great vein of Galen will unite with the inferior sagittal sinus to drain eventually to the straight sinus. Right? Okay, so that would be your venous drainage. Okay, for the corpus striatum, internal capsule, thalamus, fornix, septum pellucidum, all drain to the thalamus vein. While the choroid plexus, corpus callosum, hippocampus will drain to the choroidal vein. Yan, dalawang veins to, thalamus vein, choroidal vein. Okay? Eventually will form the internal cerebral, form the great vein of Galen. Okay, so this is a sort of a diagrammatic, no, presentation of how the internal set of veins will operate. No, the deep middle cerebral and anterior cerebral and your striate veins will drain to the basal vein, the choroidal veins, and the thalamus striate veins. We know what structure drains into them. Now, each of the three veins will form the internal cerebral vein on one side, and the internal cerebral vein coming from both sides will form the great vein of Galen. Now, the great vein of Galen plus the inferior sagittal sinus, both of them will drain to the straight sinus. Okay? So, the dural sinuses actually contain venous blood. Okay? So, these are more specific areas that are drained by what part of the which internal veins. Okay, so your midbrain drains via the basal vein or the great vein of Galen, the pons via the basal vein, cerebellum via the great cerebral vein of Galen, medulla oblongata via the spinal vein. Okay. Okay, so I was mentioning earlier that the dural venous sinuses actually contain venous blood. Okay. They contain venous blood. Then you have the superior sagittal ear, inferior sagittal sinus, the straight sinus, and the confluence of sinuses. Okay. From your confluence of sinuses, you have two limbs, your right and left limb of the transverse sinus. In each of the transverse sinus will eventually drain to the sigmoid sinus. First it will first receive, your superior and inferior pectoral sinuses before before the sigmoid sinus will drain to the internal jugular vein. Okay? So those will be the venous drainage for the brain. Now let's go to the spinal cord. Okay. Now the blood supply to the spinal cord will come from your spinal arteries, anterior and posterior. I mentioned the anterior spinal artery is formed by the union of branches coming from the two vertebral arteries. The two branches will unite as a single artery, and this artery here, your anterior spinal artery, you will find lodged in a depression in the ventral surface of the spinal cord, known as the ventral median fissure. That's where you will find the anterior spinal artery. Okay. Now you have a posterior spinal artery, this one. But unlike the anterior, it will not unite as one blood vessel. It will continue as two separate blood vessels along the posterior surface of your spinal cord, no? Okay, close to the root of the posterior nerve root. Okay, so yung dorsal nerve root. Okay. Yung entry of the dorsal nerve root to the spinal cord, that's where you find the posterior spinal artery going down. Okay. Now, the anterior spinal artery supplies the greater part of the spinal cord, meaning it supplies two-thirds of the interior of the spinal cord, while the posterior spinal artery supplies only the outer one-third of the cross section of the spinal cord. Okay? Okay. Ito. Yan. If you follow the spinal arteries, this one, the anterior, inward, okay, it will supply a greater interior of the spinal cord, while the posterior will supply the outer one-third of the spinal cord. Okay. Now, if you know that the spinal cord is quite long, okay, and that although you have spinal arteries coming from the vertebral artery, okay, it cannot supply the entire length of the spinal cord kasi mahaba yung spinal cord. Eh? And as you follow the spinal nerve, the spinal vessel, the spinal artery, as it goes downward, it decreases in caliber. So paliit siya ng paliit yung size niya. Okay? So that the small vessels in the upper lumbar and lower thoracic, okay, okay, meaning the lower four thoracic vertebrae and the first lumbar, okay, is said to be your watershed area. Watershed because this is a portion where there is already diminished amount of blood flow coming from your spinal arteries. Okay, and that's why it is prone to ischemia because of decreasing amount of blood flow in that area. Okay, when we're talking about spinal arteries. Now, fortunate enough, okay, that aside from your spinal artery, we also have what is known as your segmental spinal arteries. Now, these arteries are arteries that come from outside the vertebral column. Nasa labas po sila ng vertebral column. They are not found inside. They do not originate from inside. They do not come from within the vertebral column or vertebral canal. The segmental arteries take their origin from arteries outside the vertebral column. For example, you have segmental arteries that come from your cervical arteries. You have coming from the thoracic, meaning the intercostal arteries. You have segmental arteries coming from the lumbar arteries. Okay. Now, from these external sources, no, your segmental artery will enter the vertebral canal via the intervertebral foramen. And once it has entered the vertebral foramen, it will branch off into your anterior and posterior radicular arteries. Okay? Okay. And once they branch off into the radicular arteries, they will connect, okay? They will anastomose with your spinal arteries to reinforce the blood flow to the different segments of your spinal cord. Okay? Okay? Okay, just for a while. Okay, as I was mentioning, okay, the radicular arteries, okay, will anastomose with your spinal so that it will add, no, blood flow to your spinal arteries. So it will reinforce, okay, blood flow to your spinal arteries. Okay, now aside from your segmental spinal arteries, you will still have another group of arteries, okay, and these are your feeder arteries. They vary in size from individuals, okay, and they are different from your segmental arteries, okay, and they one of the big feeder arteries, in fact, the biggest of your feeder arteries would be your great anterior medullary artery of Madame Curie. A large feeder artery that is a direct branch of the aorta, or it can come from the left posterior intercostal artery. Most of the time, the Adamkiewicz is the artery of Adamkiewicz is unilateral or only found on one side. And look at this. It is found at this level from T8 to L1. T8 to L1. Lower thoracic, upper lumbar. What did I mention earlier as the level of the spinal cord that is prone to ischemia? It also is about this level. Okay? And God made it so that there is the medullary artery of Adamkiewicz that supplies blood to this segment. Okay. Now it is important. It is important for the neurosurgeon to be aware of the presence of the artery of Adamkiewicz, because if he's doing surgery in spinal cord, he should be careful not to disturb this arterial branch. Okay. It supplies the spinal cord. Okay? Sometimes it will supply the distal segment of the spinal cord already. No? Okay? Okay? Adamkiewicz is a Polish pathologist who discovered this blood vessel. Okay? So you have your feeder vessels, you have your segmental arteries, and you have, of course, your spinal arteries to supply oxygen to the spinal cord. Okay? Now let's talk about the veins of the spinal cord. Okay? First, we'll talk about venous plexuses. Now, when you say plexuses, they are interconnection. Okay? Interconnection of things like your brachial plexus, the interconnection of nerves. When you say venous plexus, then they are interconnection of veins. Okay? So you have venous plexuses that lie outside the vertebral canal, vertebral column. They are called external venous plexus. Then you also have venous plexuses found within the vertebral canal. Okay, they are called internal venous plexus. Okay, they are found within the vertebral canal. Okay. Now, although the internal venous plexus is found within the vertebral canal, they are found outside the dura mater, meaning they are epidural in location. Inside the vertebral canal, but epidural or outside the dura mater. Now, the venous plexus will eventually move upward or drain upward to drain to the dura sinuses once it has entered the foramen magnum. Okay. Now, aside from the venous plexuses, external and internal, it's also described to have spinal veins, meaning counterpart to mga spinal arteries mo. You have anterior and posterior spinal veins. You may have three anterior, three posterior spinal veins. Now, the spinal veins can drain vertically, okay, or upward, or they can drain uh, uh, horizontally or transversely via the medial radicular vein to the segmental vein, and they drain to their particular segment or region of the body. Like if they drain to the segmental veins that is the counterpart of your thoracic segmental vein, then they will drain to the intercostal vein. If there are segmental veins that come at the level of the lumbar, then they will drain to the inferior vena cava area, okay? And so on and so forth. So they can drain transversely, okay, or they can drain vertically upward, okay, yung mga spinal veins. Okay? Yeah. These are your internal venous plexus. Outward, here, outside the vertebral canal, is your external venous plexus. Now, of course, the two venous plexuses can communicate with each other. Okay? Ito, from a cross-section of the vertebral column, you see this is your internal venous plexus. They are inside the vertebral canal, but they are outside the dura mater. So therefore, they lie in the epidural space. Now, these are one of your spinal veins. This time, it's already inside the dura mater. It's on the surface of the spinal cord. Okay. Now, your spinal veins can also drain transversely along the segmental vein. Okay. So also with your internal venous plexus to drain to the corresponding level or segment of the body. All these spinal veins can move upward. This one can drain upward towards the sinuses, the dural sinuses of the brain. Ito yung internal venous plexus mo. They lie inside the vertebral column but outside the dural body. You notice that your internal venous plexus, your spinal veins can also drain outward on transversely or outward towards the segmental vein. The segmental vein drains to the corresponding region of the body. Now, the venous plexuses, especially the external venous plexuses, which carry blood, no, from different levels or different regions of the body. Okay? Um, have been implicated as one of the mechanism by which metastatic cells, no, coming from the pelvic region, okay, to spread to the vertebral column or to the bones. Okay, because venous blood can travel via the venous plexuses. Okay? From different parts of or regions of the body, it travel via venous plexuses and it can seed, no, the vertebral column with metastatic cells via the vertebral venous plexuses. Okay? Okay, so I think that would be all for our lecture. Okay, so any questions?